We are here with a couple of Beacon experts. We're here with Dr. Michelle Bache. She is Vice President of Medical Affairs at Elkhart General Hospital. And we're joined by Dr. Dale Patterson, who is Vice President of Medical Affairs at Memorial Hospital. So today, vaccine arrived on site at Elkhart General Hospital. About 975 doses arrived, and those will be distributed tomorrow morning for frontline workers. So we have a lot of questions to get to tonight. There have been a lot of questions that the public has been asking, that the community has raised, and we wanted to offer some answers to those. And if you guys can, please offer your own or ask your own questions, either below on my page, on the Beacon Health page. Please ask questions, and we will try to get to as many as we can in the time that we have. So we will start out with Dr. Bache. Would you be able to tell us, you know, we've been saying that frontline workers are going to get the vaccine first tomorrow. Who can expect to get it? I mean, frontline workers covers, it sounds like a big area, and the community might not even understand exactly who fits into that category. So tell us a little bit about that.
Sure, thanks, Heidi. So our frontline staff, it includes staff at the hospital and staff at urgent cares and also nursing home frontline staff. So by frontline, we mean people who would have the opportunity or the chance that they would be interacting with patients who are known to be COVID positive or of unknown status. So really our emergency department, our urgent cares, respiratory therapists who have played a big part in this pandemic, giving respiratory treatments and managing, you know, the oxygen needs for the coronavirus patients, intensivists, anesthesiologists who are at high risk for exposure when they do procedures like intubations. So those are really the people that we're going to try to target first because they have the highest ongoing exposure.
This isn't just us deciding that frontline workers are the first to receive the vaccine, right? This is part of a much larger effort.
Right. The state of Indiana has been working hard on this for you know, many weeks and trying to prioritize and set a very good roadmap for us to follow on how we should roll this vaccine out. They've done an excellent job.
Dr. Patterson, let's go to you. How will the vaccine get rolled out to the general public? I mean, after frontline workers, I'm sure lots of people are wondering, am I going to be able to get it right away? Is it going to be a number of months? And I think the month of June has been thrown out there too, I know nationally. So what can the general public expect?
Yeah, thanks, Eddie. We don't exactly know, honestly. So we know the doses that we have on hand. We know what's coming for the next couple weeks. And beyond that, we really don't know exactly how this process will play out, but we do know what the priorities are and what order those will go in. So we will start after we're able to vaccinate all the healthcare workers who want to get the vaccine, and we're able to do that. It'll start into the higher risk populations, people who are more likely to have complications. And we will have direction from the state as to how to deploy the vaccine to the people who need it to get it first to have the most benefit. So we really expect that most healthcare workers will have the opportunity to get the vaccine by mid-January. And that is dependent on the continued supply from the manufacturer. And if things go really well, we might be able to get it done sooner than that. Once that happens, then we'll start into those next phases and be able to offer it to others. So really the general public should watch the media, watch the news, look to Beacon, and we will let them know when it's time for them. And we really want them to want to get it, and we want to get them in as soon as we can. But we don't know exactly what that time will look like yet. June, we're hoping that everyone has had that wants to get the vaccine has had the opportunity to at least get that first vaccine by late spring, early summer. So June is a great month to point towards.
Now, we know, of course, that the FDA committee recommended approval of the Moderna vaccine today. So that will likely, assuming nothing holds it up, be approved in the near future. What effect will that have on the number of vaccines that are out there? I mean, we received the Pfizer one at Beacon and Elkhart General today. What can you tell us about that?
Been expecting that would get approved, and the models that I've seen from the state of Indiana really depended on the Moderna vaccine being approved as well. So we do expect that we will be receiving shipments of the Moderna vaccine as early as next week at this point. There is one final hurdle that it needs to clear with the FDA. We expect that'll happen probably by tomorrow, and then vaccine could start showing up as early as next Monday to some sites throughout the country.
Is that 2 doses as well?
Both of the Pfizer and the Moderna vaccine are very similar. They have the same mechanism. They're both 2 doses. There's a little bit of a difference in the timing. The Pfizer vaccine is a 21-day interval between the 2 doses, and Moderna is 28 days. There's also a little bit of a difference in the storage and the shipping. The Moderna vaccine doesn't have to have quite the severe cold temperatures that the Pfizer vaccine has, which will make it easier to get it to clinics and to rural areas that don't have the big deep freezers.
Which we saw all that steam or all that cold coming out of the freezer, I know, this morning when the Pfizer vaccine was put in at Elkhart General. It was kind of cool. Dr. Bache, will you tell us how long can we expect the vaccine to protect us from COVID-19?
Sure. I mean, the answer is we're not really sure. I mean, we hope that it's a long time, but we've only been administering this vaccine to people for a few months, so we don't have really the benefit of a long period of time to know how long the immunity lasts. We do know that it is very robust immunity. At least initially, it's been 95% efficacious in preventing coronavirus infections in the patients who received it. And we're optimistic that it's going to continue, but there is a real possibility that we may need to have boosters or maybe even annual vaccines going forward, similar to what we have with the flu. That certainly is a possibility.
It could stick with us for a while, is what you're saying. It's not going to go away overnight, even if we had 100% of the population vaccinated?
So if we get to really 70 to 80% of people that have immunity either through vaccination or through previous infection, then we do reach what is called herd immunity. But the problem is with viruses that viruses can mutate and they can change. So we're not really sure what the life cycle of the coronavirus is going to be. The 2 vaccines that are approved for use right now with the mRNA, or the 2 that we will have, the Moderna and the Pfizer, so they both are targeting the spike protein. So that is, unless the spike protein changes a lot, this should provide some pretty long-lasting immunity. We're hopeful for that.
What's the difference between the 2 vaccines? Dr. Patterson, could you tell us some of the differences, if there are any?
I think the things I mentioned earlier are really, for the public, are really the 2 big differences that they're going to notice is the timing of the dosing, the 21 days versus the 28 days for the second dose. And then for us, the storage, it's a lot easier to store the Moderna vaccine. With the mechanism of action being the same, it is slightly different in the proteins that it targets, but the side effects are very similar. We would expect that the longevity of the vaccine will be very similar when we get those results, and there isn't going to be a lot of noticeable differences to people. So
can you talk about the side effects? That I think might be a good segue into that, and if they're the same
they
for
are
both.
The same for both, and except for one possibility, and I'll mention that at the end, but most people, even when you get a shot, it hurts, right? So most people have pain at the injection site that can be a little bit more than some of the other vaccines that we give on a regular basis. So it might hurt more than a flu shot for the couple days after. Fatigue, headaches, muscle pains, chills, pain in joints, things like that are fairly common, more common after the second dose than the first dose. And really, the way you think about it is it's really revved up your immune system and it's working. So it doesn't mean that there's something wrong if you get these side effects. It just means that your body is reacting and your immune system is working and you're becoming immune to the virus. So most people don't miss work. Most people do just fine. They just might feel crummy for a couple days after they get the shot.
Kind of like with the flu shot.
Yeah, it's probably a little bit worse than the flu shot, honestly. And the side effects are a little bit more prominent, but they're still pretty mild for most people. Okay. There are several people now. It sounds like there's 4 people who have received the Pfizer vaccine throughout the world now after it's been released, 2 in England and 2 now in Alaska, who have had severe allergic reactions. with the Pfizer vaccine. All of those people have eventually done well, and but we do have monitoring set up for about 15 minutes after each immunization, so people will stay after they get the shot for 15 minutes to make sure they don't have an allergic reaction, and they are very rare. There is a possibility that the Moderna vaccine may not have that reaction. We just don't know yet because we haven't had enough people getting that. Only 30,000 people have received that. When we have hundreds of thousands to millions of people, we may find that it has exactly the same reaction, but if it doesn't, we may be preferencing that vaccine for people who have a tendency to have allergic reactions.
I think we hear about, any case like that. You mentioned there have been 4 of those sort of reactions, and people get worried. And I think you just kind of put that to rest a little bit. I mean, what would you say to people that hear that someone had a severe allergic reaction, that it could happen to them, and that maybe that's a reason they're not going to get their vaccine?
Yeah, I would caution people to, you have to put everything into perspective and think about the risks and the benefits. And right now, the risk of being infected with COVID and becoming sick and potentially dying from an infection from a disease by far would outweigh the risk of having an allergic reaction to one of the vaccines and having a long-term negative impact from it. No one has died yet from that. We have precautions in place to treat people if that were to happen, and it's extremely rare. So I would not let that stand in the way of getting a vaccine at this point. If someone has a strong history of allergic reactions and they carry an EpiPen with them and they've had anaphylaxis to things in the past, they should talk to their provider, talk to their doctor, and see what's the best way for them to either get the vaccine, or they may want to wait and make sure that they're getting the right vaccine for them after they talk to their doctor.
Another reason people might be a little nervous, and Dr. Bache, I'll toss this out to you, is how quickly the vaccines were developed. If you're concerned, or if people should be concerned at all about the safety aspect of receiving these vaccines.
Sure. I mean, yeah, it was fast, but there's a lot of reasons it was fast. It was fast because a lot of the technology and the research that went into these mRNA vaccines had already been done and was in place. So, it was really just trying to finalize the last pieces that were necessary to be able to deliver this mRNA successfully into the host cells. So that was kind of the last hurdle. And the other thing that was very different about this vaccine development compared to other processes and things that happen is that all the steps in the process were really happening instead of in sequence. They were all happening in parallel. So because there was such a great need to get this vaccine to the people as soon as possible, we really took big risks with this in the sense that, big financial risks. So Pfizer and Moderna, they've been manufacturing vaccine for weeks, and they've had it positioned. They have it ready to go in, hundreds of thousands of doses all over the world. That would never happen in usual circumstances. What would happen is that you would wait for that FDA approval, and then you would begin manufacturing. And that whole process, that ramp up of the production in itself could take, several weeks to months. So everything has just been really coordinated and, really warp speed.
We're going to get to a couple questions that we have. The first is, what if you do not know you have COVID and you get the vaccine? Will it help?
So we don't, I guess, so the question is, if someone has COVID, they're infected when they get the vaccine, will it help? It's unlikely to help them at that point, honestly, because it does take your immune system some time to react to the vaccine. So if you get infected and then get the vaccine, it's unlikely to help in its response, even to the point where if you get the vaccine and you get infected the next day, you may still get the disease, and it takes some time. And really, you aren't fully protected to that 95% level until after the second immunization. So it's unlikely to help you if you get it when you have the disease. Having said that, it's not, if you don't know that you have it and you get the shot, it's unlikely to hurt you. So we don't want people to avoid getting it because they think, oh, I may have been exposed or I may have gotten it, and they don't have any symptoms. If you're sick, you should talk to your doctor about getting any vaccination. But if you're asymptomatic, you shouldn't stop from getting the vaccine because you think you might have been exposed.
So you bring up an important point. I mean, explaining the importance of getting that second dose. And one of the questions here is whether you need to get that second dose exactly on the day or right around the day that you're supposed to receive it. How is that going to go?
Most of the people who we're vaccinating, we're going to be registering them at the time of their first injection for their second injection, either 21 or 21 days after that. So there is a little bit of wiggle room, so plus or minus 2 days on either side. So, you know, if it's the recommendation is 21 days, you know, and you needed to push it to 19 or to 23, that would be okay.
Another question that we have is, will the 50 Indiana vaccination sites continue to be the vaccine sites when the next wave of eligible groups are allowed to be vaccinated? And then the second part of that is, will doctors' offices and health departments eventually have the vaccines? What do we know at this point?
Yeah, so there's, you can answer that question all three ways: yes, no, and we don't know. The 50 sites that are the initial sites likely will continue to receive vaccine and will continue to vaccinate healthcare workers, you know, through that second dose and you know, other populations as needed. It's also very likely and anticipated that other sites within the counties will get the vaccine and start to help as those other groups receive vaccinations. So health departments are very likely to receive some doses to be able to distribute in their county. Beacon is looking into having doses available, just as the question asks, for in your doctor's office. So integrating the immunization into our normal flow of patient care, so we can give it to our patients when they come in for their physical, or when they come in for another visit, or even set up an appointment at their doctor's office just to get an immunization. And the part that we don't know is when that will happen and exactly what it will look like, but we'll keep letting people know as we find out more information.
So say today, I feel great. I'm healthy, not feeling any symptoms of cold, flu, let alone COVID-19. Why do I need to get the shot?
You need to get the shot to protect yourself and to protect other people. So it's, again, if we really want to beat this, we want to get back to life as normal, we need to get 70% of the population needs to get immunity either through vaccination or infection. So we see what a devastating toll on public health as well as the economy, trying to go the route of, you know, just getting people infected. That's really not a viable option. So we really need everybody who's able to get the vaccine so that, you know, even if you're not going to have a bad problem, you're healthy and, you know, there's a very good chance you're going to do well with the infection. The problem is that you can pass that on to other people who maybe aren't as capable of fighting it off or have a bad outcome. So we really need everybody who can get vaccinated to, you know, step up and do your part.
When we have both vaccines available, will we be able to, as consumers or as patients, be able to decide which one we want?
You know, not initially. That's not really feasible at this point. Now, there will be more vaccines that will be coming online, and you know, as vaccination gets more widespread, you know, that could be you know, an opportunity in the future. But you know, right now, if you really want to you know, question, you know, which vaccine is the best vaccine? I mean, the best vaccine is a vaccine that's in your arm. That's the best vaccine. So I don't think we should get hung up on, you know, different flavors or little nuanced differences. We just really need to get the vaccines.
That's a great message. Another couple questions here just came in. Are you concerned that we don't know the long-term effects of the vaccine?
Yeah, I think that's a hard question, and to be honest, you have to say yes, right? We haven't had the vaccine for a long time, and it's a new vaccine. What we do know is it's been very safe in what we've seen so far, and we know that this disease is a terrible disease, and it protects people from getting it. It's very unlikely, knowing the science behind the vaccine and the way mRNA works, all the research that's led up to these vaccines being approved, long-term effects are very unlikely. We've seen the rumors on the internet about all the different things that potentially could do that have been, disproven, or you have no evidence to support that will happen. And I'm very confident that we have a very low likelihood that there will be any unknown effects that come up in the future, and that it is safe to get the vaccine.
That's so good to hear, because even here we have someone who just commented that they're very nervous about getting the vaccine. And that hits right there, right? Because we want everybody possible to receive it. They asked, the second part of their note is, when will children be eligible or able to receive the vaccine? We don't know that yet, right? Is it anyone under 16 is recommended against getting it right now?
Yeah, the trials didn't include children, so we don't really know when that's going to be, that'll be released for kids.
Okay. What's the difference? Did we already ask that? What's the difference between the vaccines? Will I still need to wear a mask after I get the vaccine, or can I get it and just walk out and it's life as we knew it? What, late last year, early this year? We all went.
It's a step towards that goal, right? That's the goal. We all want to get rid of our masks, but no, I mean, it's not going to be possible for us to stop distancing and to stop masking in the short term. So remember that really for the vaccine to be effective, we do require 2 doses. So those 2 doses are anywhere from 3 to 4 weeks apart. And then we think that it takes the body, maybe another 1 to 2 weeks to, really have a robust immune response to the vaccine till we really get to peak efficacy. The other thing we're not sure about is, just because, I work in the ER, I'm exposed to COVID patients, there's no way that I would be able to know, even though I'm immune from my vaccination, if a COVID patient were to, cough on me, or I was to inhale a bunch of the virus or droplets get into my nose, I may not get infected with that, but we're not really sure, would I still be able to shed virus? Would I be able to shed it and pass it on to other people? So that's not clear. And so really, until we get, 70% of people, with immunity through vaccination or infection, we're really probably still going to be masking, and that's probably going to be late spring, early summer is going to be the recommendation.
Because you have the unique experience, Dr. Bache, of working directly with COVID patients in the ER at Elkhart General, I'm going to ask you, you're very passionate about people getting the vaccine. What do you see? What do you hear? Tell us a little bit about that experience in the ER and with COVID patients, especially, that makes you so passionate about the vaccine.
I see it from 2 vantage points. So, the patient's perspective, and just, really how horrible this disease is for them and their family, and, having to deal with this really unexpected illness that, in many cases, people, if they end up in the ER and they end up admitted to the hospital, about 10% of those people are not surviving. So that's, if I admit a patient to the hospital, or I admit 10, one of them I know may not be, discharged. So that is pretty emotional. The other aspect is just from the staff, and, tomorrow, it's just going to be such an emotional day for our staff. I just can't even put it into words. And I know there's vaccine hesitancy out there, but I will tell you that the front line is going to be there, and we're all going to just be clamoring for our opportunity to get this vaccine, to put an end to this 9-10 months of just horrendous suffering that we've seen. So it's just really going to be a big day tomorrow.
Sharing that. Dr. Patterson, I'll have you answer this. Another viewer would like to know, they went to their CVS pharmacy, or when they go there for a flu shot, they've had their immunization record on the computer. Is this something, this is a great question, is the COVID-19 vaccine now going to be programmed into databases and into our records to track immunization?
Yes, it will. And the state is using, for this first round of vaccines, there's a program that we're using to to coordinate with the state for scheduling and for vaccination. As we move forward, we're already anticipating that we'll be able to use our hospital and office electronic health records, and we have an existing link to a state vaccination program called CHIRP. And in order to get the vaccine, it will be required that you load your information up to CHIRP after you give it. So everyone who gets a vaccine in Indiana will be in that system, and then that also can be shared nationally, so that data can be pooled, and so your shots will follow you and people will know that you got it.
Let's see what else we need here. Side effects, healthy vaccination. I'm going to go to another question. Actually, someone mentioned thank you very much, and what a blessing it is to be able to hear from someone so knowledgeable, someone who's been so involved, and to thank you both for what you're doing for our community, which is very nice. Someone did ask, then why if you're not sure? And I'm not sure if that actually goes back to concerns, if that goes back to what we know and don't know about the vaccine, why we're being told to get it. I don't know. Is there anything that you could say to that?
Yeah, let me clarify. I mean, I guess what I'm trying to say with we're unsure is you can't prove anything, right, that hasn't happened yet.
Right.
So I can't predict what's going to happen 5 years, 10 years from now. And I don't know that what's going to happen when I walk out the door and get in my car, will I make it home? We can't prove the negative. What I can tell people is I'm very confident that these vaccines are very safe. You can't make guarantees for things in the future and what's to come, but what we know about the science of these vaccines is the way they work. They've worked very well, and they have short-term side effects. But the mechanism of the vaccine makes it very unlikely that there will be any long-term residual effects. And it's impossible to prove a negative, right? So we can't say something is never going to happen. But we're very confident. I'm personally very confident, and would have no hesitation to get this vaccine myself. And I would have no hesitation to recommend that anyone who's in the recommended groups get the vaccine.
I think you mentioned this mRNA, sorry.
mRNA, right?
Someone just asked if you can explain how the mRNA vaccine works and why that particular type is generally safe in the long term.
So these are new, it's a new technique, it's a new vaccine, and essentially what it does is they've taken, it's a part of our normal body process, right? We make RNA, which your DNA is what makes up your chromosomes and your genetics, and the mRNA is the part of that process that your body makes that tells different parts of the cell to make proteins and to have your body function is probably the easiest way to explain that. That mRNA is a temporary thing, right? It doesn't become part of your permanent genetic code. You make it interacts with the different parts of the cell, the proteins get made, and then it kind of goes away as a natural process. What this vaccine does is it gives your body mRNA, which then is taken up into the cell, but not into the nucleus, and it doesn't become part of your permanent genetics, but it has your body make a particular protein that then your immune system reacts to, and it thinks that it's seen that protein, it knows that it's seen that protein before, and if you actually get the virus, that same protein is on the virus, so it recognizes the protein and it mounts an immune response because it's already seen it before, which prevents you from getting the disease. So the expectation is that that's the mRNA is a temporary thing in your body. It mounts a normal immune response to a protein, just like if you're exposed to a regular virus or to any other protein, and then you react to a virus with a predetermined immunity because of the protein that your body actually made itself that your immune system reacted to. So that's why we anticipate that it will be very safe and won't have any untoward long-term effects.
I think it's so different than our immunization strategies in the past. With we used to take the virus and we would grow it, and then we would try to, attenuate it so that it wasn't as infectious, and then we would, inject it into people, or we would, grow the virus and kill the virus and then inject it into people. So those, carry some risks with it, and, some, maybe, more contamination risks, or, maybe the virus is not attenuated enough and things like that. So this is just, there's really no way for you to get coronavirus from the vaccine, because it's not coronavirus, it's just one of the proteins that is displayed on the virus. So it's really amazing technology and a huge breakthrough.
So it's not a live vaccine.
It's not the virus. It's just, right, it's not live. There's just no way to get coronavirus from this vaccine.
Let's go to another question. We had to do a little work on this one before we asked it, because they asked if, or they know that ACOG, which American College of OBGYNs, right, is recommending that pregnant women get the vaccine, but this makes them very nervous, as there are no studies in pregnancy, and they were wondering what your take is on that.
So that's a conversation for, the patient and her physician. So, you should have that discussion. Yes, it wasn't tested in pregnant women, but, this does not appear to cross the placental barrier. We don't think that there's any, risk to the fetus itself. But, again, as Dr. Patterson said, we can't really prove, the negative, or prove that there isn't going to be a problem. But we will have more data as time goes on, as many more women do take up the virus or take up the vaccine. So I think it's just important to talk about those concerns with the physician.
Okay. Another question: do we know? We kind of tackled this a little bit. Do we know if it will be a yearly shot or just once? And they want to know if you guys are receiving the shot as well.
Yes. So we don't know if it will be if you'll need a booster, if it'll be yearly. That will somewhat depend on the vaccine, and it will somewhat depend on the disease in our society. So there's a lot to learn yet there. As far as will we get it? Yeah, I'm signed up. I have my appointment for January 8th and plan to get it. So I
tomorrow I'm as an ER physician. I'm frontline, and I can't wait.
Yeah, the only reason I'm waiting that long is to let some of the other people who have more risk of exposure and want to get it sooner. Otherwise, I would get it sooner.
Thank you for sharing that. And Dr. Bache, we'll be with you tomorrow morning to see you get that injection then. Is there a timeline you should follow after receiving the vaccine, or for receiving the vaccine after testing positive for COVID?
So the recommendation is to wait 3 months, just because, in general, there is probably more demand for this vaccine than there is supply at this point. So if you were eligible to receive the vaccine at this time, but you've had coronavirus less than 3 months ago, we would ask that you wait. But there's no other concern. There's, no risk just because you had the coronavirus, and have recovered. That assumes, you've recovered. We wouldn't recommend that you get the vaccine while you are sick. But if you've recovered, then there is really no health consequence. We're just asking that, people consider waiting just because of the demand.
And I think that timing of how long we do wait, or when do we know when to receive it? When will the public know that it's their turn to receive the vaccine? How will I know?
We will. We can promise you that we will let you know. The federal government, I know, has a plan to let people know when it's time to get immunized, and to promote immunization, and to tell us how that can happen. I know the state health department is working on that as well, and as a health system, we're working on that as well. So we want to provide people with as much information as we possibly can. We want them to get good information. So I would recommend that you look to the Beacon website, to the Indiana State Department of Health, and the Centers for Disease Control, or CDC, and watch those websites and see where we're at with the deployment and how you go about getting your vaccination.
Let's see, a couple more here. Someone wanted to thank you for advocating for those who are not in the medical field. So they want to thank you. And if someone, let's see, is this another one? Okay, if someone tested positive for COVID, but didn't test positive for the antibodies, should they still get the vaccine?
Yes.
Great question.
Yes.
Any further explanation or anything surrounding that, or not really?
No, they should. I mean, they should get the vaccine. So again, we think that most people who have had coronavirus, we haven't seen reinfections within the 90-day period. So we feel that it's safe to request that people wait for 90 days after they have had their infection. But there's not any reason to not get vaccinated. And yes, you should get vaccinated.
What have we learned even so far? I know we're only giving the first vaccinations tomorrow, but there's been so much research. We've done so much planning at Beacon. What have we learned so far to today, and what do you look forward to learning as we start to give the vaccines tomorrow?
So, we've learned a lot about the process, and we've learned a lot about the physical, the storage and the transportation and arranging the clinics to be able to be efficient. The things that we'll start to learn more as we get more vaccinations is, exactly how do those side effects, when do people feel them, what do they notice, how do you make them better? How do you minimize the side effects to people? When's the best timing as far as, should you take try to get it on a Friday if you work Monday through Friday, those kind of things. It's really going to be making it a better experience for people as they get the vaccine now. The vaccine is done, it's ready. We've learned all about the science. Now the big task is getting it into as many arms as we possibly can, as fast as we possibly can, and to make it as convenient and comfortable to people to get that done and have the least amount of impact on their lives after they get it. So those are the things that we'll be learning and looking for as we move forward over the next couple weeks.
Dr. Bache, what will success look like for you?
I think just as many people as possible taking up this vaccine. So, getting back to life as we knew and loved it, getting back to, going out, going to restaurants, socializing with friends, getting rid of our masks, going back to, healthcare that isn't focused so much on coronavirus, being able to, deliver all the care that we know we need to deliver. So really the most critical piece of that is going to be, really a widespread uptake of this vaccine. So I'm just hopeful that the public, trusts and, follows our examples. I think, the frontline workers we're going to be there, and we're so ready.
There's another question. Is this an intramuscular injection?
Yes, it is.
Yeah.
Some of these questions are a little over my head. Sorry, I'm just passing them along to the experts. What is that? Can you?
It goes in your arm, in your deltoid, in the muscle.
Okay.
Yeah.
What other messages or what other questions even have you heard that maybe we haven't asked or no one's asked or addressed here tonight? Or what messages then would you have for the community? Again, tomorrow's an exciting day. What message would you have?
So I guess my message would be, I think we've hit most of the questions that I've had come up. There's some individual ones where people, and I would always recommend that if you have concerns, talk to your doctor, ask when you're there to get your vaccine. Make sure that you get all your questions answered, you're comfortable to get it. But my message overall would be, there's going to be skepticism. This is a new thing. Things have changed dramatically in the last 9 months. But being in the hospital for the last 9 months, and I'm sure Dr. Bache would agree, we walk through the halls and we see the patients on ventilators, we see the patients on high flow oxygen. I've been in the room with 2 doctors that, caught this either at work or from, their families who aren't here anymore. They died from the disease, and they would have loved to be able to get this vaccine before that happened. And the risks of getting this vaccine are so much lower from what we know than getting the virus itself. So I would look ask people to be logical about it, look at the risks and the benefits, and ask their questions, get reassured as much as they can. But we don't want to have more people dying from this disease in the hospital. We want people to get the immunization because it works and because it's safe.
And Dr. Patterson and Bache, I want to say or offer my condolences to those two colleagues of yours in the physician community here locally, as you said, who have lost their lives to COVID. Dr. Bache, final message to the community tonight, and we will say too, please, we want people to keep asking questions after they watch this, and if they are watching it on tape, watching the rerun, so to speak, and hopefully we can do more of these in the future, because questions I'm sure will continue as we continue to learn things. But what would your final message be, Dr. Bache, to anyone watching this and who may maybe they have additional concerns or reservations?
Yeah, so thanks for taking that first step for trying to inform yourself and get the information that you need. So I think that that's really important for people who take the time to watch this to understand. And also please consider getting the vaccination. Please consider it not just from your own vantage point, but for society in general. If we want to go back to being able to go to concerts, if we want to be able to, do fun things like, go to, restaurants and have dinner parties and be able to do this safely without worrying that we're going to inadvertently spread a deadly virus to, our loved ones. And, we really need to take this step, and we can't just depend on other people to do that. We need, a big portion of this population. We really need everybody to step forward and, take this shot. So
thank you so much, Dr. Patterson, Dr. Bache, for your time tonight. Hope you have a very happy holiday and stay healthy and have a very safe holiday season as well. Thank you.
Thanks, Heidi. You too.
Heidi.